You know, many find it hard to believe I own a sleigh that can fly. But you know what I find hard to believe? The unbelievable offers going on at the winter event.
The Mercedes-Benz Winter Event is back with incredible offers on the sporty CLA, the thrilling C-Class, the versatile GLA, the safe and secure GLE, the innovative GLC, and of course, the unequaled E-Class. But hurry, because these sleighs are going fast. Visit MBUSA.com/winter event. Mercedes-Benz, the best or nothing.
Blog Talk Radio.
World won't get no better if we just let it be. Na 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 na. The world won't get no better. We gotta change it, yeah, just you and me.
Welcome to this late edition of What's New with VHHughes. I'm your host, VHHughes. My usual co-host, Vanessa Henderson, is not available tonight, but the show must go on. So tonight's subject, we're going to look at some of the current topics in healthcare news. 3 in particular: the pap smear versus the HPV test, blood test accuracy not easily measured, and a study on how fat and heart disease are linked. So first subject: each woman, once they get around 18 years old or sooner, depending on how sexually active they are, they have a pap smear. And that is a test where a speculum is inserted into the vagina and swab is taken of the cervical cells, and this actually is looked up under a microscope. And it is a way to look at cancer cells, or to make sure that there are no cancer cells present. So recently, this week, there was a move, if you will, to sort of get rid of the pap smear test and just go with the HPV test. So what happened is that U.S. health experts recommended that the test for cancer strains of the human papillomavirus, which is HPV, be approved to replace the pap smear. And this is for women with cervical cancer. However, this whole plan had some skepticism with it. They didn't have approval from the American Cancer Society. The American Cancer Society basically said, you know, we have been using the pap smear all this time, and we don't even have any guidelines for the HPV test. So when we're looking at the pap smear versus the HPV test, the pap smear is used to find cell changes or abnormal cells in the cervix. And these abnormal cells may be precancer or cancer, but they also may be other things. Cells from the cervix are removed, processed, and then looked at under a microscope to see if the cells are normal or if changes can be seen. This test is very good in finding cancer cells and cells that may become cancer. HPV is a virus that can cause cervix cells to change. The HPV test checks for HPV. The test can also do the same thing, can be done at the same time as the pap smear. So a second swab or the same swab that is taken can be used. When the pap smear is called a pap smear plus test or co-testing. And this is usually done for women 30 and older. So the big thing that is going on is that they're basically trying to replace the old standard. They're trying to change. They're trying to make things, new again. They're trying to say, okay, well, we've been using the pap smear all this time. Well, now we have this HPV test, and, it's basically the same thing, only it's better because it can give more information out. The American Cancer Society said there's little comparative effectiveness data comparing primary HPV screening with co-testing. Current guidelines by the American Cancer Society and other medical associations call for the dual test for both pap smears and HPV tests every 5 years to screen for the risk of cervical cancer for women between the ages of 30 and 65. For younger women in the age bracket of 21 to 30, the recommendation is only for pap smears every 3 years. So why even put us women through all of that? Why even have us go through the fact that we're thinking now, oh wow, we don't have to, have this dual test or to give you guys a visual, to be laying there waiting for an extra scrape or whatever that may be needed to be done, depending on the situation, to have a sort of one-size-fits-all for this. And, to have this basically going throughout the country is going, oh, well, the HPV test, more research needs to be done. We don't have the whole picture when it comes to that. We're so busy to jump on the latest, greatest thing, but we never seem to realize that we need to have our research done. We still have the debate about the HPV vaccine. So now we're trying to move out the regular pap smear test because we now feel that the pap smear is antiquated, and the pap smear test gives out more. The HPV test, gives out more information than the pap smear would. That's not necessarily true. That is not necessarily true. For decades, pap smears have been used to check abnormal cells in the cervix as a first line of defense against cervical cancer. The smears are designed to give direct evidence of microscopic cancerous changes in cells. Testing for HPV, which causes more than 99% of the cervical cells, is relatively a new diagnostic tool. Pap smears, first of all, require doctors to scrape the cervix and loosen cells to test, while the HPV test requires them to swab the cervix for a test sample, which I guess as a woman, it would be more comfortable to do that. It would be less invasive to have a HPV test as opposed to a pap smear test. However, we have done the pap smear test for so long, and we're getting all the knowledge from the pap smear test. So, in comfort, yes, the HPV test would be more comfortable, definitely, especially when you're a woman lying there just waiting for it all to be over. But again, not getting everything, not testing for the correct thing. I don't know. I think this is another one that's going to be up for debate for quite some time. Join the conversation. Guests can call area code 347-826-7959. Again, that's area code 347-826-7959. So getting back to pap smears versus HPV. Each year, about 12,000 women in the United States are diagnosed with cervical cancer. 4,000 of them will die from the disease, and this is according to the CDC. Many of these ladies, and I remember when I was single and out and dating, and there was no information about HPV. It's more, of course, knowledge about it now. Of course, they have the vaccine now. And the fact of the matter is that your vagina is not the only place HPV can be. The thought process in vaccinating daughters and I believe now sons, because I know that there was a vaccine that they wanted to do for the young men as well, the thought process is that, well, this won't happen anywhere else. That is incorrect. Wrong, wrong, wrong. HPV is associated with vaginal and vulvar cancers in women, but it can also lead to penile cancer in men. It may also lead to anal and throat cancers in men and women, as well as genital warts. So it's not just one area. Something to think about, just something to think about. Next subject that's out in the news, if you will, is about blood test accuracy. What do you mean? Well, researchers in Georgetown found that levels of 10 substances in the blood differed congenitively in congenitively normal adults who develop mild amnesic impairment or Alzheimer's within 3 years, compared with a similar group of people whose condition remained intact. The researchers reported that the 10-marker panel had both specific and sensitivity of 90% of distinguishing the two groups. But they left out an important statistic for judging the usefulness of such tests, as it will be applied in the clinic. They were trying to find out, when you become older, if your blood is taken, how would these tests basically change as you age? As your body age, would your test basically come out the same? And so what they're saying is that when someone has a dementia or an Alzheimer's within 3 years of taking a particular test, that test changed. False positives and false negatives happen. Now, in essence, this test is more so, of course, for our older demographics. But as our population gets older, and it does every day, this is something that they need to be aware of. Doctors are constantly prescribing medications for all different reasons. And, of course, before they prescribe anything, they may give a blood test. If that blood test is off and it indicates that the patient is, say, positive for diabetes, and it's a false positive, then that patient is being treated incorrectly. But this happens with the changing of the blood. Now, again, more research has to be done on this. This was just something that came out, and of course there are always a huge rush to put the information out there and give everybody that aha moment, that knowledge that make them to be aware of. And it is something to be aware of, especially with our population getting older. But who's to say that in a few more years they'll find out that this whole light that they have shed on the blood change, if you will, regarding the testing within a 3-year time span somehow decreases because of the fact that we have finally found something to sort of remove the impairment that is actually making the false positive or the false negative. Science is always busy making the newest and latest information to come out. And where is that something with more seniors living up to at least 90 and sometimes beyond, cognitive impairment does happen. But then again, there are some seniors who are that old and they are very much sharp as they were when they were younger. This is also, this test, and hopefully they will get some more answers, because it's not just a link, if you will, for just our seniors with Alzheimer's, but when you think about if someone who has been in a accident and they have brain damage, this can actually help with the line of treatment and possibly repairing the damage and making everybody, have their memory come back and having a test. So there are things that definitely can benefit in this study, but much more research has to be done, especially with more seniors, both when it comes. But it does give hope in finally sort of basically finding out how to combat Alzheimer's or dementia, or again, somebody who has brain damage for whatever reason. So if we can finally pinpoint the correctness of the blood test or the inaccuracy of the blood test, we could get some definite hope on finally being able to have everybody. But it's definitely something to look at. At this point, it says it doesn't matter anyway, because the consequences of having a false positive result are relatively mild. Mainly, it would be unnecessary brain imaging and keeping the person, when it comes to any damage to a young person on a bench for a while. A false positive result will be evident quickly when the symptoms remit and never appear in the first place. The test does not offer the prospect of identifying most concussed players within the matter. So we're dealing with concussions in this point. But when it comes to our seniors, when you're that old and there's a false positive for you, and you have to, go get an MRI and you have to go through that machine, that's already disturbing in itself. So definitely, again, more research needs to be done on that. And our final subject for tonight, in looking at all the latest things for this week, because there was quite a few things that came out this week. Definitely the pap smear versus the HPV test was a huge one on my list because for one, I'm a woman, and for two, it was something that was really, really talked about on the news. And then we have the administrative procedures for categorizing with the Food and Drug Administration, genomics and health information fellowships, common causes of kidney dysfunction after a transplant. But our last thing is regarding the study that is being done regarding the link between fat and heart disease. And what it's really talking about is that we've always been told that saturated fat was found in meat and butter and cheese, and it caused heart disease. But an analysis has been done, and it's been found that there's no evidence that eating saturated fat increases heart attacks or any other cardiac. The new findings found that through a growing body of research, that fat is inherently bad for you. It all depends on what foods you eat, which, of course, we know that. Growing up, we used to say, you are what you eat. And if you eat ice cream all day, well, you're ice cream in the inside. Okay, you're technically not ice cream on the inside. But if you're not nourishing your body with nutrients, your body is not getting what it needs to do to function. But we have so many things with so many foods out there with hidden sugars and fats and salts. That's another one, salts. That, reading a label, and then, of course, you have to know how to read your nutrition label. You have to know how. It's not going to always say sugar. It's not going to always say salt. You have to know the buzzwords or the keywords in order to sort of identify what's listed on that food label. So the research said that, and it was published on Monday, it did not find that people who ate higher levels of saturated fat had more heart disease than those who ate less, nor did it find less disease in those eating higher amounts of unsaturated fat, including monounsaturated fat like olive oil or polyunsaturated fat like corn oil. Again, I'm pretty sure this is not going to be the only study on this. It seems like there's going to be always a study on this balance between what helps and what hinders our bodies, whether it's caffeine or I think the latest thing was about chocolate, and they're coming out with a chocolate pill, and it's supposed to give you all the nutrients of chocolate in its raw form, so it won't be just like going out and eating a candy bar, but it's giving you the healthy portion of chocolate in a pill form. The thing is that we need to be cognizant of what we're eating. We need to be cognizant of what we're drinking. Everything that we put in to our bodies affects our bodies, good or bad. It is not just a simple, I'm going to eat this and it's going to pass through and I'm going to be okay tomorrow. It's not that simple anymore. Some things linger for a while. Everybody is looking for the weight loss pill or the quick way to lose weight, or the only way to do it is diet and exercise. A proper diet. I'm not talking about eating a cracker and drinking some water. A proper diet where you're having all of the food plate or pyramid, depending on how it's set up where you are, and you have all the groups actually present, and you're getting them in the right amount. And I know now there are drinks that actually have the vitamins and minerals that are needed for the food groups. Again, read your label or learn how to read your label. If you don't know how to read your label, reach out to a nutritionist to see if they can help you understand how to read the label. Or contact H3P. We can help you read the label. The thing is that there's always a new this or that, a new way to eat. If you eat just meat, you lose weight like this. Or I think the latest thing out now is if you drink a certain kind of tea, the weight will come off. What people don't tell you is that if you stop the tea, the weight may come right back, or extra weight may come with it. You know, once you start a program, once you start a regimen, especially in exercising, once you start that regimen, be consistent with it. Keep working on it. It's not going to be an overnight thing. Even those people who go out and get the surgery done, they still have to learn how to eat the correct way. They still have to exercise. They still have to do all those things that they tried to avoid in the first place when they went and got the surgery done. It is amazing to me because they went out and they got this surgery done, so they went and laid on the table, and now they have to learn how to eat all over again. And for some, it really, really works well for them. And for others, they have to go back through the surgery sometimes more than once because they still haven't got that mindset of how to really take care of themselves. If you haven't basically changed your behavior and you have just sort of fixed the problem in your mind, you fixed the problem because you're now skinny, or your definition of skinny, but you still decide to eat the same way, you really have wasted your time because you're going to continue to do the same things. I mean, you know, that's the definition of insanity. Continuing to do the same thing, expecting a different result. Many of these people decide to do this or have the surgery in order to avoid the exercise, only to find out at the end of it that they still have to exercise. So in essence, they just prolonged it for a little bit. They sat it to the side because they had to somehow get themselves together. Again, more studies will be coming out. As always, I encourage everyone to do their own research. I see all the different diets out there and things like that, but definitely the only thing I can really suggest when it comes to diets, and I do mean as far as dietary, is to consult a nutritionist, truthfully. But definitely, when it comes down to all of these subjects, do your research, do your homework, and, you know, have conversations with your neighbors and friends. So, this has been our late night run with What's New with VHHughes. Hopefully next week my co-host will be joining me again. She was a little under the weather today. But next week we're going to be talking about using medications wisely. We're going to talk about some of the things that happen in all kinds of demographics, whether they're parents or seniors or teens. So, as always, it's been my pleasure. This is VHHughes. You guys have a wonderful night, and talk to you next week at 3. Bye-bye.
Whew. ho, ho! You know, many find it hard to believe I own a sleigh that can fly. But you know what I find hard to believe? The unbelievable offers going on at the winter event.
The Mercedes-Benz Winter Event is back with incredible offers on the sporty CLA, the thrilling C-Class, the versatile GLA, the safe and secure GLE, the innovative GLC, and of course, the unequaled E-Class. But hurry, because these sleighs are going fast. Visit MBUSA.com/winter event. Mercedes-Benz, the best or nothing.
Ho, ho, ho! You know, many find it hard to believe I own a sleigh that can fly. But you know what I find hard to believe? The unbelievable offers going on at the winter event.
The Mercedes-Benz Winter Event is back with incredible offers on the sporty CLA, the thrilling C-Class, the versatile GLA, the safe and secure GLE, the innovative GLC, and of course, the unequaled E-Class. But hurry, because these sleighs are going fast. Visit MBUSA.com/winter event. Mercedes-Benz, the best or nothing.